is my patient. I'm doing a respiratory assessment, a cardiovascular, and a GI assessment. So the lungs have 2 lobes on the left side and 2 lobes on the right, or 3 lobes on the right side. There's the upper, middle, and lower, and then upper and lower on the lungs. So when you're listening to the lung sounds, you'll listen in different areas. Okay, so I'm gonna go under your shirt. We'll start up on top here, listening around the trachea. Okay, can you take a deep breath through your mouth? All right, then I'm going to move over and do it to the same side. Perfect. And then I'm going to move below into in between the first and second intercostal space. Move to the other side. Perfect. And I'm going to go lower. Okay. Perfect. Then I'll go lower again. Perfect. And one more time. Okay. Then I will move to the anterior side. So I'll just have you sit up for me. Perfect. And when I'm back here, I'll just show you. Okay. And when we listen to the lung sounds posteriorly, we do it in this order. So go ahead and breathe in. Perfect. Perfect. We'll go lower. All right. And then I will also listen on the sides. Okay. All right. When I'm listening for the bronchial sounds, I would listen up around the trachea. And then for the bronchovascular sounds, I would be listening in between the first and second intercostal space. Okay, now I'm going to be doing my cardiovascular assessment. So I would listen to the heart in these places. You don't have to do it, I think I can film it. So I'll go over on his right side and I would listen to the aortic, and then I would listen on the left side in the second intercostal space, and it would be the pulmonic. Then I would move down and listen to the Erb's point area, and then I would move down to the fourth intercostal space and listen to the tricuspid, and then I would move down lower and I would listen to the mitral valve. And then what I'll do is I will check pulses. So I check the carotid pulse, which you'll find right here. And then I'll do both sides. Okay. And then the brachial pulse, which is the inner elbow. And I would do both sides. pulse. And then the pedal pulse, which is down on the foot. And those are equal bilaterally. Then I would check capillary refill. And his is less than 3 seconds. And less than 3 seconds. And then I would check his extremities for any edema. Okay. Alright. Okay. No edema. And he's equal bilaterally. Okay. So for my, oh my gosh, you can't even see me. My GI assessment, there's 4 different quadrants. We have the right upper quadrant, left upper quadrant, the right lower quadrant, and then the left lower quadrant. So for this assessment, the order that I'll be doing it in is inspection, auscultation, percussion, and palpation. So I would inspect. You lay down flat for me. So I would inspect for any distension, any scars, bulges. Then I would auscultate, and there's different types of bow sounds that you can hear. There's normoactive, which is between 5 and 30 bow sounds per minute. There's hypoactive, which is less than 5 bow sounds per minute. Hyperactive, which is more than 30 bow sounds per second, and then absent, which is no bow sounds. But I would listen going from the right upper to the left upper to the left lower to the right lower. I would listen for a minute each, and then if it is hypoactive, then I would listen to it for 5 minutes in each quadrant. So. Okay. My patient's bow sounds are normoactive. And then I would palpate. No, I would auscultate or percuss, but we don't do that. So I would palpate and see if he has any tenderness.